So hello, my name is Samuel Bonahasa. I'm an epidemiologist and working with the Infectious Diseases Research Collaboration. Today we are here for the malaria vaccine launch. It's an exciting day because malaria is a big problem to all of us in Uganda. We have about 15 million cases every year of malaria as of the last World Malaria Report. Several interventions have been put in place, including nets, bed nets, IRS, that is insecticide for killing mosquitoes on the walls of houses, appropriate treatment, timely and appropriate treatment for malaria is a key intervention. But despite all of this, we are still the third highest contributor to malaria cases in the world. Uganda is still the third highest contributor to malaria cases in the world. And so the malaria vaccine comes as another intervention. Yes, the number of malaria cases that Uganda contributes to the world, we are the third highest contributor of malaria cases in terms of the burden of malaria. And the malaria vaccine is an important additional intervention, and as IDRC we support the ministry. We work with the Ministry of Health and with Makerere University and other collaborators to do research on malaria, HIV, TB and other infectious diseases of public health importance, and we've contributed to malaria research for close to 20 years now, supporting the work of malaria control and seeing the impact of the different interventions on malaria. So adding the vaccine is a great thing because it adds, it also reduces the chances of a child under 5 suffering from malaria or getting severe disease with malaria. So it's a great addition to the malaria control toolkit. And so that is why today is an exciting day.
How do you do that research? How do you conduct research?
So we support the Ministry of Health, health centers across several parts of Uganda to do surveillance. Surveillance is collecting routine data on malaria cases using the outpatient registers they have in the facilities, and they're able to track that. So we provide CMEs, we train them, build their capacity to do diagnostic. CMEs, it's continuous medical education where we train them to manage malaria appropriately, diagnose properly, treat appropriately, also tracking their stock in the health facilities and using the data that they are getting to make decisions about the care for their communities that they are providing. So we provide that support to surveillance across a large part of the country. But as well, we have capacity in the Ministry of Health Central Public Health Lab in Butabika, where we support the capacity to look at different types of parasites of malaria, because there are different types of malaria parasites, to understand which parasites are developing resistance to anti-malarial drugs, because over time parasites are trying to evade the treatments that are there. So we're able to track and see which parasites are developing resistance to anti-malarial medicines, which ones are developing resistance to diagnostics, the things we use for testing. And with the coming of the malaria vaccine, we also will have capacity to see which parasites might change over time with the introduction of malaria vaccines. So giving this capacity to the Ministry of Health and supporting with this is important for decision making, for policy, for the management of malaria, both now and into the future. IDRC is a non-profit organization, and it is formed as a collaboration between Makerere University and other research scientists from different parts of the world, and we have a memorandum of understanding with the Ministry of Health, which is active and supports all the work that we do. So we are very much a part of the Ministry of Health and the activities that are going on.